Moving to Ireland comes with a bit of a mindset shift around healthcare. If you're from another European country, you should prepare mentally for the fact that Ireland does not have a free-for-all universal healthcare system. And if you are an American hoping to escape the private healthcare companies and get pampered by free medical care, then some of the information in this video might come as a bit of a surprise and maybe even a bit of a disappointment for you. Hello everyone, my name is Mia. I'm originally from Finland, but I've lived in Ireland for the last 6 years. This video is based on my own personal experiences of healthcare in Ireland, as well as some additional research that I've done. For help for your specific relocation case, I would encourage you to reach out to a relocation specialist. You can also start with some of the links for extra readings that I've put for you in the description box below. Let's start with some basics. What does the Irish healthcare system look like, and what are some of the most important basics that you should know? First, in Ireland, there is both public and private healthcare available for you as an option. Interestingly, in Ireland, nearly 50% of people have private health insurance, and the public and the private systems are much more intertwined than they are separated. Both the private and the public systems run through the GPs or general practitioners and the services that they offer. GPs act sort of as gatekeepers to Irish healthcare, and as a first step, you should make sure that you sign up with a local GP when you first arrive in Ireland, whether you will go public or private with your healthcare in general. Let's start by talking about public healthcare. Ireland's public healthcare is managed by HSE, which stands for Health Service Executive. HSE is very much the backbone of Ireland's public healthcare system, and if you are using public healthcare in Ireland, you will be dealing with the HSE in some way. HSE services are available to everyone residing in Ireland, I believe at least for a year, and it is supported and funded by the state. In today's Ireland, HSE operates public hospitals, funds or provides GP and community services, runs the ambulance service, provides mental health services, and oversees public health programs such as vaccinations and screenings. Unique about the HSE is that it's both a provider and an administrator. In many European countries, the government funds care but doesn't run it. But in Ireland, the HSE runs hospitals and services and manages eligibility and funding. That dual role can lead to the system feeling a bit bureaucratic at times. So, what are the pros and the cons of the public healthcare system? For you as an expat or an immigrant, the key selling point is lower overall cost. Public healthcare is heavily subsidized by taxes, so many services are either completely free or they are relatively affordable compared to other countries with fully private systems. For expats who are employed in Ireland, are paying taxes, or legally resident in another way, this can make healthcare accessible without extremely high cost for the monthly insurance. Another pro is access to essential care. With public care only, you can still receive GP care, hospital treatment, emergency services, maternity services, specialist referrals, and chronic illness support. So even without private insurance, you are not excluded from medical treatment in Ireland. With public healthcare, you can also qualify for medical cards or GP cards. The Irish medical card provides broader access to public health services. If you qualify for a medical card, your GP visits or family doctor visits are free of charge. You also receive access to a wide range of public healthcare supports. This generally includes public hospital services, subsidized prescription medicines, and access to certain public dental, eye, and hearing services. Eligibility is usually based on a means test, which considers your income, family circumstances, savings, and residency status. In general, you must be an ordinary resident in Ireland, meaning that you live there and intend to remain at least for 1 year. Examples of basic medical card weekly income thresholds are here. These are for people under the age of 70. If you are over 70, more generous income rules apply. The GP visit card is a more limited healthcare support focused on specifically free GP appointments. Unlike the medical card, it does not cover prescription medicines, hospital care, specialist treatment, dental, eye, and hearing care, etc. Because the income limits for the GP card are slightly higher, so it allows for a broader range of people to qualify for those benefits. The HSE looks at net weekly income after expenses, together with household size and dependents. Some groups qualify automatically for the GP visit card. These include children under the age of 8 and adults 70 years and over. Good to also note that if you apply for a medical card and don't get accepted or don't qualify, the HSE might assess whether you qualify for a GP visit card instead. An important positive point about the public healthcare system is that you get good emergency and acute care. Ireland generally provides strong emergency treatments and acute hospital care once you enter the system. And now to some of the downsides of the public healthcare system in Ireland. Long waiting times. This is the biggest issue most foreigners notice. Waiting times for specialist scans, outpatient appointments, elective surgery, and non-urgent procedures can be extremely long. It is not uncommon to have to wait months for specialist consultations or close to a year to some non-urgent procedures. For someone not used to this kind of drag of the government-run healthcare, it can be quite frustrating and something to really get used to. Difficulty finding a GP. In some areas, especially cities or rapidly growing towns, GP clinics may not be accepting new patients. This can surprise expats who assume that family doctor or GP registration is automatic, but it is not. So again, first thing when you arrive in Ireland, find a GP and sign up ASAP. It's better to sign up as soon as you can rather than wait for something to happen and then having the stress of not being able to get an appointment anywhere. Overcrowded emergency departments is the next negative. Public hospitals can become very crowded, especially the A&E departments. So accident and emergency department. Less urgent patients might experience wait times of about 8 to 12 hours, which is crazy, or even longer during peak periods. Even the public healthcare system is not fully free. So even with just the public healthcare, there are some costs that might fall on you, such as GP consultation fees, emergency department charges, prescription costs, and consultant-related expenses. Many expats arrive expecting a fully free national healthcare system similar to the NHS in the UK, but the Irish system works differently. And this might be a bit hard to hear. It was really hard for me to wrap my head around the disappointment. This is definitely something really important for you to take in and understand that even with the free public health, it's not fully free. Now let's move on to the private healthcare system in Ireland. Private healthcare usually operates through insurance providers such as VHI Healthcare, Leia Healthcare, and Irish Life Health. Private healthcare is not really a thing of the rich as it would be in Finland, and it is very common. So almost 50% of Irish people are signed up both for the public healthcare as well as carrying private healthcare insurance as well. Here are some of the pros of having private healthcare insurance in Ireland. The first thing is probably, at least for me, the biggest selling point, and that is faster access to care. Private healthcare can dramatically reduce the wait times for consultants, diagnostics, specialist appointments, and elective procedures. Instead of waiting months, you might maybe be waiting days or a few weeks. You'll get greater choice and convenience. Private patients often have more consultant choice, access to private clinics, shorter queues, and more comfortable facilities. Private or semi-private rooms are also often available for private health insurance holders. Private healthcare might also provide easier transition for expats and immigrants. Many expats prefer private health insurance because it feels more predictable, resembles systems in other countries such as America, and it can help reduce uncertainty during the relocation. And it certainly can provide a bit more of a peace of mind as you're adapting to a new country. Private insurance is also helpful for families. Parents often value quicker pediatric access and specialist appointments for children. And from personal experience, I can tell you this one is huge. Waiting 4 to 6 hours with a sick or injured child surrounded by a bunch of other sick and injured children for such a long time is no fun. Now to the cons of private healthcare. Of course, it comes as no surprise to anyone that the premiums can be quite expensive. Private insurance can be costly, especially for older adults, people with pre-existing conditions, or families. Premiums can easily cost thousands of euros annually. Another downside is the insurance complexity. Policies can be confusing and coverage varies significantly depending on hospital access, consultant coverage, waiting periods, excess charges. It's easy to underestimate how difficult this plan comparison can become. Another thing is you will likely still use the public system sometimes. Even with private health insurance, emergencies will still likely go through public hospitals, ambulances are public, and some specialist infrastructure overlaps with the public system. So private coverage does not completely separate you from the public healthcare in Ireland. Some upfront payments would also have to be done with private healthcare. So here, in many cases, you still pay first and then claim reimbursement later, especially for GP visits, outpatient consultations, or prescriptions. This surprises many newcomers to Ireland, so I thought it's worth mentioning. So those are the basic pros and cons of public and private healthcare in Ireland. But an important part of that healthcare here, whether you go public or private, is the whole general practitioner or GP system. So let's dive into that next. When people become ill or have health concerns, they will usually see a GP before accessing specialist or hospital services, since GPs are able to diagnose and treat a wide range of common illnesses and injuries. This is how the Irish GP system works in brief. So a GP is your primary care doctor for routine medical issues, prescriptions, referrals to specialists, chronic disease management, vaccinations, sick notes or certificates, and preventative care. Unlike some countries where specialist access might be a little bit more direct, in Ireland, you often need a GP referral for public specialist care and many private consultants. GPs are typically independent practices, not assigned automatically by the government. Usually you pay per visit, unless you have a medical card or a GP visit card. Here are the typical costs of paying for GP visits privately. These are just approximate ranges and can vary by location and clinic as well. It's important for you to know that many GPs have very long waiting lists and may not be accepting new patients, or they might be prioritizing people living nearby. So as soon as you know where you will be living, it's important to kind of do some research on what GPs are close by to you. And if you live close by, you'll be more likely to get into those GPs. For most of you watching, I would probably recommend some sort of a hybrid approach. You can use the public system for major events, major needs for emergency care, or anything that requires an ambulance kind of thing. And you can still carry private insurance for speed and convenience. This tends to provide financial protection, shorter waiting times, and more flexibility. That way also you won't miss out on government-sponsored schemes. There are a lot of different schemes. If you would like me to make a more detailed video on those, please be sure to leave some comments below. There are some helpful links in the description box below that you can check out, and I do recommend reaching out to a specialist, especially if things in your case get a little bit more complicated. Thank you so much for hanging out with me today. If you found this video helpful, be sure to give it a like and subscribe so you don't miss out on future videos. And I hope to see you again next time. Take care. Bye-bye.